This is a high-speed photographic study of the mechanism of the larynx in the production of the falsetto. The subjects are vocalists at various levels of training and skill, ranging from virtually untrained to professional. An overall view is shown here of the photographic setup for taking high-speed motion pictures of the larynx at 5,000 to 8,000 frames per second. The camera is mounted overhead. The control panel is in the rear. The tape recorder is in the foreground. The physician observes the larynx through a viewfinder. A laryngeal mirror, which the laryngologist uses in routine office examinations, is introduced into the mouth, passed back into the throat, and the larynx visualized. High-speed motion pictures are taken as the larynx is observed through a system of lenses in the viewfinder. In ordinary speech and singing, the voice has a certain quality and mechanism of production which is encompassed by the term fundamental registration. This is the appearance of the larynx in fundamental registration as visualized by a laryngeal mirror and photographed at the usual sound speed of 24 frames per second. When the voice ascends into its upper reaches, it assumes a lighter, less complex quality known as the falsetto. In passing from fundamental to falsetto and back, there is often a sudden acoustical and physiologic change known as the falsetto break. Obviously, some quick change in mechanism of production is occurring, but ordinary camera speed is too slow to reveal its nature. These vocal cords, or thyroarytenoid muscles, are vibrating in fundamental registration at about 300 times per second. They strike each other firmly along their entire length in a massive type of approximation. In this untrained vocalist, you heard a sharp break in the voice, and you will now see it. The break begins here. Note that vibrations are no longer rhythmic, and the vocal cords are blown about without any discernible pattern. This is because there has been a quick relaxation of the vocal cords with sudden loss of tonus and control. There is little change, however, in the length of the glottic opening, which is maintained in its elongated position by contraction of the invisible cricothyroid muscles. The cricothyroids oppose the thyroarytenoids, or vocal cords, and put them on tight stretch. In ascending from low to high fundamental, these muscles pull against each other with increasing tension and finally reach a point where continued rise in pitch by this mechanism is impossible. A quick muscular readjustment then occurs to bring the falsetto mechanism into play, and this moment of transition is the falsetto break. Returning to the falsetto break in the untrained vocalist, relaxation of the vocal cords is so complete that they are blown about uncontrollably by subglottic air pressure. This is happening within a fraction of a second. Finally, the vocal cords recover their tonus as the falsetto mechanism comes into play, and there emerges again a rhythmic but now different vibratory pattern, the falsetto. This incompletely trained vocalist is ascending on a glissando in the fundamental or lower register, sometimes called the chest register. In attempting to negotiate the break and shift gears, as it were, to continue upward, the vocal cords actually come to a momentary stop. As the vocal cords relax, note how they are put on stretch by continued and unopposed action of the invisible cricothyroids. And now the falsetto. Here again is the typical appearance of fundamental registration, with the tightly approximated thyroarytenoid muscles, which comprise the substance of the vocal cords, being forced apart at regular intervals by subglottic air pressure. As the break approaches, there is a slight but not basic change in the vibratory pattern. At this instance of transition to the falsetto, the vocal cords again relax. But training has effected a change, and the period of time during which the vocal cords were out of control was, as you saw, much shorter than in the untrained vocalist. The cords recovered their tonus quickly, but they no longer meet in the midline and directly resist the rising air column, as they did in lower or fundamental registration. The muscle bundles have relaxed, and they now lie laterally. Only their medial margins vibrate. This is pure falsetto. The vocal cords in the falsetto maintain sufficient tonus to withstand subglottic air pressure and not be blown about as in the falsetto break, but they do not contract powerfully enough to meet firmly in the midline. Since the main mass of the vocal cords is out of the way, the lighter medial margins, and especially the vocal ligaments, can be forced to vibrate at a higher frequency by the same or even less air pressure. Because less mass is thrown into vibration, the overtone pattern of the falsetto is not as complex as that of the fundamental, and it is acoustically thinner and lighter in quality. In a trained vocalist, continued elevation of pitch within the falsetto is accompanied by increasing tension of the vocal margins. In this sequence, pitch rises and then falls within the falsetto, but the speed of vibration is so reduced that it is not apparent. High-speed photography has so slowed the action that changes in pitch are best demonstrated in a frame-by-frame analysis. The vocalist is about to make the transition from falsetto back to fundamental registration. And now again, fundamental registration. Training will reduce the falsetto break to a point where it may not be detected in the singing voice at all. And in the film, even at high speed, it happens very quickly. At this point, the shift from falsetto to high fundamental is occurring. In this glissando, we must watch carefully to observe the transition from fundamental to falsetto. It occurs here. Note the lighter, airier quality of the vibratory pattern. There are three distinct kinds of falsetto action. Most characteristic is this open chink variety, in which the vocal cords do not touch each other as they vibrate. The glottis, therefore, is never completely closed in any phase of the vibratory cycle. The second type of falsetto action is the closed chink, in which the margins of the vocal cords touch each other. Contact is light but definite, as we see in this still sequence. The glottis is actually closed. Contact of the vocal cords is more apparent here because of greater rebound at high intensity. Even though the cords touch, the basic mechanism is obviously falsetto and quite different from fundamental. Notice how the cords appear to spring apart after momentary contact, a characteristic of the falsetto. The third type of falsetto action may be termed damping. Damping differs from the open and closed chink forms of the falsetto and is far less common. It is characterized by progressive closure of the glottic chink, usually from posterior to anterior. This effectively raises pitch to its highest reaches by reducing the functioning length of the vocal cords and, at the same time, immobilizing much of their substance, so that less resistant mass is thrown into vibration. The term damping should not be used as a synonym for falsetto because it represents only one type of falsetto action. This expert tenor will ascend one full octave and then descend through the area of what would be his falsetto break if he were untrained. There are some vocalists in whom no sudden shift in mechanism of voice production is discernible. and whose entire range acoustically seems to be encompassed in one register. Here we pass from fundamental to falsetto without any really sharp line of cleavage between the two, acoustically or photographically. This is known as coordinated registration. Such an artist, by virtue of training and talent, has achieved superb control of his thyroarytenoids. Instead of sudden changes in tension in passing between registers, the transition is effected gradually with controlled and selective contraction and relaxation of the thyroarytenoid muscles. In the skilled falsetto, there may be a far greater number of muscle fibers actively contracting at any one time than would be possible in the less skilled. This, of course, is falsetto. Note the relative immobility of the main substance of the vocal cords as compared with more massive movement seen in fundamental. There is mucus on the vocal cords, and its behavior reflects their rapid movement. As pitch descends and chordal tension and vibratory rate decrease, this mucus will settle down. Pitch is descending, and the vocalist is making a slow, smooth transition back to fundamental. This vibratory pattern is strikingly different from that of the falsetto. Here again we observe the phenomenon of coordinated registration over a 2-octave span. This represents the ultimate in vocal training and skill. The falsetto is a complex mechanism and an integral part of the human voice. The neurochronactic, or Hussan's theory of voice production, postulates that in speaking and singing, the glottis is opened by active lateral contractions of the vocal cords. This is in contrast to the generally accepted view that the vocal cords are not capable of transverse contractions, but rather are thrown into vibration by subglottic air pressure. This subject will phonate on a carefully rehearsed pitch, but he will not know whether the tracheal stoma is open or closed. Actually, it is open, so that air escapes through the neck and not through the larynx. The vocal cords have assumed the phonatory position. They should now evidence rhythmic lateral contractions to establish pitch if the neurochronactic theory is correct. There are none. No vibratory activity is evident in the absence of subglottic air pressure. This larynx is in the resting or respiratory position. The vocal cords are approximating as the subject attempts a singing tone. The tracheal stoma is open, and the rising air column will escape through the neck and not through the larynx. The vocal cords have approximated, and we now await their vibratory activity. There is none, and none occurs as long as the tracheal air column is diverted from the larynx. All we see is some movement of the ventricular band. This larynx also shows that the vocal cords are incapable of active lateral contractions in the absence of air pressure. Even though the tracheal air column is escaping through the neck, air impinges on the undersurface of the vocal cords, producing some degree of subglottic pressure. The vocal cords, far from vibrating spontaneously, are essentially sphincteric in their behavior and positively resist this air pressure until it becomes great enough to overcome their resistance. Air pressure has reached a point where it has overcome the resistance of the tightly approximated thyroarytenoid muscles and has induced slight vibratory activity. This promptly subsides as the vocal cords successfully resist further subglottic pressure, and they are again completely immobile. When the tracheal stoma is uncovered, the vocal cords should not immediately stop vibrating if they are rhythmically contracting because of neural impulses. But they do stop at once when air is diverted from the larynx, and they remain motionless, as you saw in previous sequences, until air is again forced upward through the larynx. Note the absolute stillness of the light reflections on the vocal cords. When the stoma is closed and air is diverted upward through the larynx, we note first a small central opening, then progressively larger ones as subglottic air pressure builds up and exerts its full effect. This is not the picture of actively contracting muscles, but rather that of a sphincter stubbornly resisting pressure from below. If the neurochronaxic theory is correct, the innervated or functioning vocal cord should evidence transverse contractions and begin to move before the paralyzed one at the onset of phonation in order to establish pitch. The normal vocal cord does not move first. It vibrates together with the paralyzed one when both are activated by the rising air column. If the innervated vocal cord does not move before the paralyzed one, and at the onset of phonation they start to vibrate simultaneously, we may assume that their movements are passive and due to subglottic air pressure only. Note the atrophic changes which have taken place in the paralyzed vocal cord on your left. Even though the paralyzed cord is atrophic and somewhat stiff, both vocal cords still begin to vibrate at the same instant. The vocal cord on your left is paralyzed. Again, they begin to vibrate simultaneously. This action demonstrates, as in the tracheostomy sequence, that resistance of the vocal cords must be overcome by significant air pressure before they will move laterally. The vocal cord on your left has on its margin a bit of mucus, which moves first when the rising air column reaches the glottic chink. The vocal cords themselves are thrown into vibration only when the pressure head becomes great enough to overcome their resistance. These high-speed films reveal that the vibrations of the vocal cords in phonation are due not to their active lateral contraction, but to subglottic air pressure.